Hey, welcome back. It's Mitchell with Everyday Epidemics here with an exciting episode from a recent webinar about wastewater surveillance right here in Oregon. So today you'll learn about wastewater surveillance, its efforts, and all of the benefits that it has for public health. Hope you enjoy the episode. Let's get into it.
My name is Mitchell Kilkenny, and I actually serve as the tobacco prevention coordinator for Douglas County. I really became interested in wastewater surveillance when I realized that these traditional data sources like the student health survey and tobacco sales reports, they just weren't accurately capturing these nicotine use patterns in my community. And especially in rural areas like Douglas County, we often see these low participation rates. We see other challenges, and these create significant data gaps. And that really makes it difficult for us to do our work, makes it difficult to track emerging trends, or even measure our program effectiveness. And it was during this journey that I started learning about wastewater surveillance. And I was connected to the folks that you see here at the Oregon State University. And I think what fascinated me most about this approach is that it has the potential to provide unbiased population level data. And not just on tobacco use, we'll hear from them talk about viral diseases, substance use, and even broader community health patterns. And unlike these traditional surveys, wastewater doesn't suffer from response bias or underrepresentation. It provides a complete picture of the entire community because at the end of the day, everyone contributes to wastewater. Wastewater surveillance really does, I believe, have the potential to modernize our public health data collection in ways we've never seen before. Imagine being able to identify drug use hotspots, measure the real impact of our prevention campaigns by tracking those long-term trends, and detecting viral outbreaks perhaps before clinical cases even appear. So those are just a few of some of the real-world examples that we will explore today. But this webinar isn't just about sharing information, it's really about building momentum for a wastewater surveillance pilot program right here in Oregon. Because this group, our team, we want to launch a small-scale pilot program to demonstrate wastewater surveillance effectiveness. And really our ultimate goal is to expand this tool statewide, modernizing public health surveillance, and equipping you all with the tools you've needed probably for a very long time. And in order to make this happen, we need support from the ground up. So today is about sharing information, answering your questions, and hopefully garnering your support to help us secure funding and move this initiative forward. As you listen, I encourage you to think about a couple of things. One, how could wastewater data enhance your specific work? And what questions could it help answer for your community? And with that, let me hand it over to Jennifer to get us started.
Great, thanks Mitchell, and thanks to everybody who is taking the time to join us this morning. While Mitchell brings up the slides, OSU has been engaged in wastewater surveillance starting in 2008, running up to 2016. And as you'll hear from Tyler a little bit, definitely picked up it yet again, but with a focus on pathogens starting in 2019, but that's more of Tyler's story. So OSU has been engaged pretty early on in terms of the wastewater surveillance. So you'll see a little bit of background this morning. So the first slide is why wastewater? And what we know is there's some really nice reviews out there. So pathogens have been surveilled since 1939. Apparently this was a tool in understanding prevalence of polio surveillance and also helped eradicate polio. And in terms of wastewater surveillance, we saw from this poll just a minute ago, some of you are quite familiar, some of you are less familiar with this, but we certainly understand that it's a current tool. It's established in terms of substance of abuse. It was really got a toehold after that early work in the mid 2000s. It's now an established and practiced technique both in the European Union as well as Australia. So you see deployment at the international level. Next bullet tells us that during those initial attempts, illicit substances were the subject, right? Legal drugs, illegal drugs, but now again, we've picked up the pathogens again, notably in COVID-19, but Tyler's going way beyond there. And we know that these pathogens and these substances are actually found in municipal wastewater. Why municipal wastewater? You see the overhead aerial shot. This is a site that is as close as we can get to individuals without being about individuals. And then, so in other words, that's our closest site to the toilet, and it has the least amount of transit time. And wastewater treatment plants, next bullet, tell you that these treatment plants are built in a way that we're aggregating and collecting wastewater from all over a municipality. And that infrastructure is focusing our sampling efforts at this location that is ideally suited for this kind of approach. So on the next slide, you'll see that now we know so we can get direct measurements of pathogens, illicit drugs, legal drugs, and biomarkers, meaning things that are indicative of human population, whether it's ammonia or creatinine or other such indicators. And you'll see why that's important in just a moment. And so it turns out we're getting quantitative information, not just whether a molecule is there or not there. We can actually quantify its concentration, and we can do some cool things with concentration. And because it's quantitative, and it is more potentially real time, meaning wastewater is flowing daily, hourly, right now in your communities, there's that potential for less bias compared to surveys. Mitchell mentioned that just a minute ago. What's really critical here is that we take 24-hour either flow or what's called volume proportional samples. In other words, we don't just go in and take one sample, we actually take a series of samples over 24 hours to get a representative snapshot of that community. And it's influent, not effluent. Effluent's more about what's going out to the environment. That's important, but we want to get as close as to people to monitor what's being excreted in a community. That's why we do influent. If you look at the next bullet, we compare, we'll probably need that next bullet too. So we now can combine these concentrations with the wastewater flow. And this is a number you can get from your wastewater treatment plant. If we go to the equation, and I know everybody loves equations, we can take that first term, which is nanograms of substance per gallon of wastewater. That's our measurement. We go to the wastewater treatment plant and say, how many gallons per day went through your system? That's gallons per day. You can cancel out gallons, and then we can divide through by population or a biomarker that's indicating how many people are using the facilities that day. And that's how you get a per capita estimate of a mass flow, nanograms per day per person. And that's a pretty useful number. And that's something perhaps you can compare to other sources of data, say, such as surveys. And the biomarker is a newer idea, but it's been used by other places like ammonia, for example. How do we understand the population? So there are tools here, even if you don't have an exact estimate of population, there are ways to get decent estimates. So on the next slide, what you see is how do we do this? So this is the analysis part. Once you have this wastewater composite that's representative of what's flowing through your community, we take it to our instruments. And the instruments that we use, liquid chromatography, mass spectrometry, is actually the same instrument that you might have seen in CSI, which is, I don't know, crime scene investigation. That was a show some time ago. It's the same instruments that analyze urine for workplace drug testing. And you also test Iditarod urine too, using this kind of instrumentation. So very widely used in the drug testing world. So wastewater is just dilute urine. So we have these calibrated instruments, we feed it with our target compounds, we calibrate it so that we are getting quantitative measures. And you can see down here in the bottom right, we can get measurements. This is actual wastewater. You can see MDMA, oxycodone, hydrocodone, and methadone in actual wastewater at very low concentrations, but easily quantifiable from those peaks that you see in that lower right-hand picture. So those are our target substances. And the data we get, these concentrations that I mentioned, and then we calculate the per capita use, it turns out you can actually deliver that kind of information in a time scale of weeks, and not necessarily the kind of data that's so lagged in time that you may also be using in your positions that might be lagged by months or years. And then we also frame this data in extensive quality control in the laboratory. We can't have false positives or false negatives in this kind of work. The other unique system with the instrument shown in the upper right-hand part is this kind of new instrumentation actually looks at everything all the time. And you're going to hear why that's important when Jared and David start talking about their sections. But what's really interesting, let's say there's a drug that would pop up in a community while we're running this program, but we didn't know it was there, but we learn about it after the fact. We can actually go back into this archive data system and say, well, what did happen with this substance now that we know about it? So you can go into this archival information, retrieve that information at a later date. So that's a real benefit. So in terms of the logistics, how does this work? Well, each of these little cartoons suggests like a home that is on the wastewater treatment plant system. It is a network of pumps and pipes that all take it to that central location down, suggesting the wastewater treatment plant, WWTP, at the bottom of this figure. And so we know that as toilets are being flushed, these signals are being sent to that wastewater treatment plant. And so we think about these molecules or pathogens, Tyler's going to tell you about pathogens in just a moment, are actually moving through these tubes and these pump stations to get to that wastewater treatment location, that treatment plant. And we know that biodegradation of some things can happen en route, and we're very well aware of that. We take precautions to try to minimize that. We know is that as those materials move, so we're really interested in minimizing or understanding if biodegradation is happening. And the whole goal of the infrastructure to make wastewater surveillance happen is we're then trying to collect and preserve these samples. Basically, we collect and freeze them, and that's to really shut down any biodegradation. So we're getting an accurate snapshot of what substances are moving through, literally through people in that municipality and being collected in the wastewater treatment plant system. Next slide will be the kind of information that we get from wastewater surveillance. And what you can do is you can have multiple cities, like let's say 6 different locations, or if we're lucky, lots of locations in the state of Oregon. And you can take a snapshot of what's happening on the same day everywhere at the same time. So you can compare municipalities. You can then, because it's per capita, that means we've accounted for population. You can see where usage is high versus usage is lower. And so that kind of snapshot is one kind of information that we can actually see. Then the next type of information is where you can actually follow a substance. Let's say benzoylecgonine. This is what, when people take up cocaine, what you'll see is, like, for example, if we look at benzoylecgonine, that is the primary human metabolite of cocaine. So when cocaine is ingested, 97% of that dose is excreted as benzoylecgonine. So it's a really good marker for cocaine, and it occurs in much higher abundance. And if you compare the traces in red and green over time, that's what that top panel is telling you. That's days of the week on the x-axis, load, milligram per person per day on the y. And you have methamphetamine in the trace below. And this is, again, data from somewhere between 2008 and 2016 here in Oregon. You can see that there's more of an episodic nature to benzoylecgonine. And that's one possible way that you can express recreational use of a substance, this episodic weekend high. That's, I guess, a pun, a weekday low. And then when you look at methamphetamine, you see a much flatter usage. This is not considered a recreational drug. And so these patterns are potentially being used by public, because this all comes from speaking to public health officials who are very well aware of recreational versus non-recreational. And now we have some substances that are also medical. And so this deep knowledge that you all have about community use will actually be very important, that you come to the table when these patterns come out and use your knowledge together with this chemical knowledge to create a much bigger integrated picture. And then lastly, post hoc analysis, as mentioned earlier, can be done with archive data. So for example, we didn't know that fentanyl was such a big deal as it is now, but let's say there's now a new substance coming, and if it pops up during one of our studies, we can go back and retrieve this information at a later date. So the next slide. What other kind of information do we get out of wastewater surveillance? Well, this slide, you have 3 maps of Oregon. This was a one-time snapshot taken again back between 2008 and 2016. And it was, what's the spatial distribution on the same day in the same, in these various locations throughout the state. And these were all voluntary participation. And the bigger the bubble, the bigger the per capita use. And you can see distributions for benzoylecgonine in the upper left-hand corner, MDMA in the lower left-hand corner, and you can see methamphetamine in the right-hand corner. And then again, speaking with public health, the public health community, people who are very versed in this, they immediately saw the relationship to transportation corridors. They were found that urban versus rural was information that they found particularly useful. And also looking at hospitality regions and calling it the 2 wallet problem. You have the people who rent the condo and people who come in and clean up afterwards. So people like me, I don't have that knowledge, but working together with public health members, this is how you make the most out of these kinds of data sets. We land on what can we do moving forward? We certainly want to modernize our target substances. what is interest, what input has implications for public health. You heard Mitchell explain earlier how smoking is an issue in his region. So we can look at nicotine, cotinine, which is a degradation product of nicotine, and anabasine, which is a vaping indicator. Vaping is newer. This is something that hasn't been done in Oregon before. The next line tells us that fentanyl and fluorofentanyl are current drugs of abuse, certainly of great interest to a lot of people in a lot of locations. Next line tells us that xylazine, which is a veterinary tranquilizer that is often found co-occurring with other drugs of abuse, is something that we didn't do in our earlier studies, but it could be done moving forward. And in the next line, we know that cannabinoids continue to be of interest. Since our early work, we of course now have legalized cannabis. We have recreational and medical use, legalized use in the state of Oregon, but getting good data on its prevalence using wastewater has not been done before in the state of Oregon. Next line. And lastly, ethanol derivatives, conjugates that the body makes during consumption of ethanol, and that's what gets excreted. This would allow us to understand alcohol consumption across these locations, and that was not done in our previous studies. So that's just a taste of the target substances that can be added to and expand using this particular tool, wastewater surveillance. And at this point, we turn the talk over to Tyler.
Gave a fantastic introduction to wastewater surveillance, and this is just on this slide here, just a brief overview when we focus on pathogens. So with pathogens, when you're infected with a virus, you will shed it through your feces. That ends up in the wastewater. If you sample at the wastewater treatment plant or anywhere en route, you can then identify the presence and concentrations of those pathogens. You can even sequence them. And then, as Jennifer was saying, we start to compare this with public health data to see how reliable is this and how can we use this new tool. So we started this project in the spring of 2020 when COVID first hit Oregon, and I'm going to tell you a little bit about some of our early results. Next slide, please. So for wastewater surveillance for pathogens, it starts with the sample collection. As Jennifer mentioned, 24-hour composite samples is the best method, so that's what we do as well. You can do it at a wastewater treatment plant, which is in the upper left-hand corner, and so then that's the whole community in one snapshot. Or you can see we have a couple of students lifting a sampler out of a manhole in the lower left-hand corner, and that allows us to isolate individual neighborhoods or even individual buildings if desired. Once we collect the wastewater sample for viruses, we found that the majority of them are stuck to the particles inside of wastewater, so we filter it to get the solids. Once we filter it, we then put it into a stabilizing agent, such as DNA, RNA shield. What that does is it inactivates the pathogens, so it's safer to handle, and it preserves their signal. We then get the virus off of that filter by beating it really hard with a bunch of rocks. And that's what you see in that little tube there. We call that bead beating. And we get the virus back off of that filter. We then extract the RNA or DNA, if it's a DNA pathogen, and we quantify it using a type of PCR. So we've done droplet digital PCR, qPCR. And you can also sequence it to identify the variants or strains that you're dealing with. And then we report it to the authorities. So early in 2020, I teamed up with a bunch of other OSU professors on a team called TRACE. And the goal of TRACE was to identify how much COVID-19 was in Oregon. Because if you guys remember, there was an early time. We didn't really have tests out yet. There was a lot of uncertainty. This map here of Oregon shows the communities that we went to. So we went to Newport, Corvallis, Springfield, Eugene, Bend, Redmond, Boardman, and Hermiston. And the TRACE team, we had hundreds of students helping out, and they were going door to door doing random nasal swab sampling of individuals in each of these communities. So the goal is to get at least 200 participants to get their nose swabbed. And then from there, you could test those swabs for the presence of SARS-CoV-2 and then put that into a statistical model, and you can get an estimate of the prevalence in that community. Well, all along the way, my collaborator, Christine Kelly, and I were measuring wastewater for the presence of the SARS-CoV-2 virus to see if that could work as well to help inform public health officials. And in particular, I want to highlight Newport, which I have there circled in green. As you guys may recall, Newport was one of the first communities in Oregon to have a COVID-19 outbreak. That was in early June 2020. So we went there with the trace team, and we went there on 2 different weekends, once in June and then 3 weeks later in July. During that time, each visit, there was over 200 nasal swabs sampled. But then within the community of Newport, which you see to the right there, we were able to sample from 22 different pump stations, which allowed us essentially to identify virus concentrations in 22 different neighborhoods, which is what you see color coded to the right, as well as the influent, which gives you the whole town of Newport. And what we found was the following. When we first went there, the random nasal swab sampling estimated that there was about a 3.2% prevalence of COVID-19 in the community. Those pink dots you see in the map are reported cases, geolocated from OHA. And then the heat map aspect there is the concentration of the virus in the wastewater. We call that gene copies per liter, but basically it's viruses per liter. And what you can see is that where we see a lot of pink dots, we see a lot of virus in the wastewater. And when we don't see many pink dots, we don't see as much virus in the wastewater. So we went back 3 weeks later, Trace once again did their nasal swab sampling, and they found the prevalence to be much lower, 0.6%. The number of reported cases in that week was also much lower, as you can see there with the pink dots. And the overall wastewater concentration of the virus was also much lower, as you can see a lot more blue and purples. But what we do see is where we did find virus in the wastewater, we also found cases, right? So it's still lined up. And so this was some really important work. We published it in 2022 in Environmental Health Perspectives. And then in 2023, the National Academies of Science, Engineering, and Medicine republished this work to hold it up as an exemplar of this is how you can use wastewater surveillance at the neighborhood scale. And so we were really proud of that. But one thing that we were struggling with a little bit was if we plotted our SARS-CoV-2 concentrations in the wastewater, that's your x-axis, versus the cases reported per 10,000 on your y-axis, and both of these are log scale, what we see is a definite positive relationship. They're definitely correlated, but we had a fair bit of spread, about 1 to 1.5 orders of magnitude. And as public health, you could probably appreciate there's a big difference between 10 per 10,000 and 100 per 10,000 in your community. So this is kind of a big spread for our wastewater. And we were trying to figure out why. Why could wastewater mean so many different cases? And we tried all kinds of things, crazy normalizations, different methods. We were trying our best. But what we found was when we took the wastewater and we plotted against those prevalence estimates that came from random nasal swab sampling, we get a nearly perfect correlation. And what this is indicative of is that the wastewater was fine. It was the cases that were off. And that's because of all the sampling biases that everyone on this call really knows about with cases, right? Lack of testing, home testing, refusal to test, testing fatigue, access to healthcare, all of these things weigh into it, making cases a little more variable. And what we see is that wastewater is actually very not variable. As Mitchell said earlier, it's reliable and everyone is participating. We also did this at the Corvallis campus at OSU here. On to the right, you will see a sewer map that I made of OSU. So that is the OSU campus. Every circle is a manhole, so a spot where we could test. Every red circle is a spot where we did take samples from. And in particular, if you look in the lower right-hand corner, you will see where I highlighted something called East Campus. That's a location that basically collects all the wastewater from campus. It all passes through that spot. And at the same time that we were doing testing for wastewater surveillance, again, the rest of the trace team was doing random nasal swab testing of people on campus. And what we see here is the results of those random nasal swabs are in the orange positivity markings there in the triangles, and the wastewater concentrations are in the black circles. And once again, we see a very tight correlation between, in this case, percent positivity versus the concentration of the virus in wastewater. So building on this success, we partnered with the Oregon Health Authority to create a statewide wastewater surveillance program. And here's our website here. What we have that's public facing as well as that website is our OHA wastewater surveillance dashboard, which has a web address that is horribly long on the left-hand side, but there's also a QR code on the right-hand side. But if you were to go to this website, and then you can click on either SARS-CoV-2, influenza, or RSV. Those are the 3 pathogens we're currently monitoring. What you'll see is a map of Oregon with each circle representing a community that is participating in our program. They send us weekly samples. The coloring is just the trending category that's increasing, decreasing, or plateaued. And this just tells you who's out there. But if you click on an individual dot, next slide, So I picked on Corvallis. Then you can see time series data. And we can see here, again, the colored circles are the wastewater concentrations. And again, the colors mean increasing, decreasing, or plateaued. And empty circles are non-detects. So you can see them going up and down. And then in the gray lines, once again, that's the percent positivity from statewide COVID testing. And you can see they line up reasonably well. Now we do it for other pathogens. So we do this for flu. And again, this is Corvallis. And I think the thing I want to point out here is that, again, percent positivity for flu in the gray lines, we see detects basically only during flu season, which is when you want to see detects, right? And so this is just showing us that you can also see something that's here every so often, and it correlates again fairly well. And then finally, we did a big study where we looked at our sequences for the different variants within COVID-19. And what this is showing here is that the solid circles are the percent of a variant in wastewater in Oregon at that time. And this is epi-weeks on the x-axis. And then the open circles are the percent of a variant in clinical samples in Oregon at that time. And what you see here is a near perfect correlation between wastewater and clinical samples. And wastewater, we just did a handful of samples every week, where clinical samples get the same data. You need thousands of samples every week to get the type of spatial resolution that we're seeing. And this becomes really important. During the peak of the Omicron wave, Oregon was sequencing over 2,000 clinical samples a week. We probably didn't need wastewater then. Then by end of May, we're down to like 6 samples a week, right? So you just basically have a very porous data stream with very little spatial resolution. But this is where wastewater can help fill that gap. And then I just wanted to show that, we generated this a little bit with the website, but this is another publication we had where we showed that SARS-CoV-2, RSV, and influenza in the wastewater, they all correlate well with percent positivity for those viruses within the state of Oregon. So we're finding this to be a very reliable method. And I don't have time to talk about it, but I just wanted to let you know that we have done many more pathogens besides the 3 I've mentioned. When the World Athletic Championships were in Eugene in 2022, we surveyed for all of these pathogens, right? RSV, MERS, hepatitis A and E, we got adenovirus, so on and so forth, and measles even. And so we've had success doing surveillance on numerous different types of pathogens, mostly at the pilot scale. So finally, real quick, so the advantages of wastewater surveillance we found is that you can monitor an entire city with 1 sample, as Jennifer had mentioned earlier, so it makes it reasonably inexpensive. It correlates well with pretty much every pathogen we've looked for so far, including COVID-19, so it helps with trends. We can identify hotspots within the community. We can get variant composition of a whole community from a single sample. As Mitchell mentioned earlier, there's less sampling bias because everyone poops. Really, the biggest sampling virus is if you're sewered or not, right? If you're in a septic tank, that's a little different. There's a 100% participation rate, which became a big deal during COVID-19 because people got tired of getting their nose sampled. And so it's a passive type of surveillance. And we found it to be a very reliable source of statewide and localized data when funding streams become scarce for other efforts. And so we think that that's how this data can be most useful, is to help supplement other data streams coming in. And from that, I would pass it on to Jared and David.
Thank you, Tyler. Appreciate it. So David and I will talk about the work that we've been doing with the team. And so this is a framework that is guiding our work to connect the holistic chemical composition wastewater sampling to community and social conditions. Our research is in the early stages of development, so we welcome and value your feedback. So please give us comments at the end on what you think about this part of it. So this is just a conceptual workflow illustrating how we're going to use non-target chemical data with 3 examples of application, including media or web scraping, social determinants of health, and policy evaluation. So what are non-target chemicals? Jennifer talked about some of the target chemicals that her group has looked at in the past. And really a target chemical is something that you can buy an authentic standard for. And I estimate that this represents about 0.1% of all the chemicals that we can detect with our instrumentation. So non-target chemicals are pretty much everything else. The remaining 99.9% of chemicals that are detectable in a sample. And so I think it's important to say that when we make decisions based on only 0.1% of the data, those decisions are probably biased. We're probably not getting the whole picture of what's going on in the community just by looking at a narrow suite of chemicals. And so that's something that I've been working on since at OSU for the last 7 or 8 years, is really trying to make sense of this non-target chemical data. So I've got this figure here, which is a non-target chemical analysis of a wastewater sample, a single wastewater sample, and there are over 20,000 detectable chemicals in here. And so when you look at this, it's hard to make sense of the data here, and you might even think that it's random. It's probably not random. You can see kind of some bands streaming across from left to right. So even looking at this raw data, you do detect some patterns. But when I look at this, I think, oh my gosh, there's so much valuable information. There's a hidden story about humans in our communities that it's recorded in the chemicals that come that are present in the wastewater. And so I like to ask, what story is hidden in this data? So we've only recently started looking at wastewater, but I've done a variety of environmental analyses. And when we start to mine the chemical data, moving away from this raw, just looking at chemicals and their numbers, we can start to mine this data to extract patterns, and these patterns become really, really clear. The data is absolutely not random. And the closest example that I have is from a monitoring that we did of 4 different creeks at various times of the year in and around Corvallis. And the main conclusion that we were able to draw was that the patterns present in the chemical data really reflect processes that are occurring within the ecosystem. And so if this non-target chemical composition captures cross sections of ecosystems, then it seems reasonable that the same kind of holistic chemical composition, these chemical gradients present in wastewater, really capture cross sections of our community. And these chemical gradients probably represent biochemical metrics of community condition and well-being. And so the overall composition is probably the sum of each of these metrics, or the sum of the different conditions or states that collectively we as a community occupy. And so the challenge that we're working on and solving right now is really reconstructing understanding these chemical gradients, linking these chemical gradients to human health metrics using existing data. And so this is just a reminder. I'm going to go over an example of connecting non-target data to non-target chemical data to media web scraping. And then David's going to talk about social determinants of health and policy evaluation. So Tyler mentioned this World Athletic Championship. This is the first time that I worked with Tyler doing this temporal wastewater sampling. And so the World Athletic Championship was in Eugene in 2022, from the middle of July, 15th of July to the 25th. And so Tyler and his team went out to different neighborhoods at locations where the World Athletic Championship was being held, at locations that were offsite, both before, during, and after the event. And so we had 162 samples, and across all these samples, we detected about 27,000 different chemicals, which you can see in this plot. And so the real question is, like, these non-target chemicals are unknown. They probably represent something meaningful in the community. And so we really need different data sets to be able to help us explain what's going on in the chemical composition that's detected in the community. So we thought, okay, well, a newspaper is probably a decent representation, a cross-section of what's going on in the community. Maybe we could use the words that are present in newspaper gradients to explain the chemicals that are present in the chemical gradients. And so we got newspaper stories, daily newspaper stories from the Eugene Register from the end of June until the end of August. And we detected about 10,000 base words. And so what a base word is like the root word with all the different suffixes cut off. So jumped, jumps, jumping, jumper. Those all reduced down to jump. And then we used a variety of statistical tools, most notably non-negative matrix factorization, to identify the dominant word gradients that were present, to explain the chemical gradients that were present. And so using this tool, we found 2 dominant word gradients. The one in orange is probably related to the World Athletic Championship. I put this red bar at the bottom to highlight the dates that the World Athletic Championship were going on. So this July 15th to July 25th. And so you'll see this orange bar, this orange line really peaks overlapping with that red bar. You see a few peaks occurring before this event, and I suspect that might be due to advertising, letting the community know that something's going to happen in the future. And as soon as July 25th rolls around, there's radio silence, and so it makes sense they stop reporting on the event at its conclusion. And so we can look at those words, those particular words. I just picked the top 20 that this non-metric factorization, non-negative matrix factorization tool uses the words to build this gradient. So what are the top 20 words used to build that gradient? I've got that here in this bar plot. What you see are words like meet, race, finish, record, American, event, athlete, final, championship, win, track, field. So very strong evidence indicating that this gradient that we were just looked at is related to this World Athletic Championship. And so then we use another technique called canonical correlation to link the word gradients that maximally correlate to the chemical gradients. And what we see are these, top 10 chemicals that best correlate with the word data set. So this is hot off the press data. I just finished this up in the last day or two. So I haven't gone in to see if any of these chemicals make sense. Do these correspond to, say, doping drugs or anything like that? So still trying to figure this out. But it's just meant to highlight how we're using community level data to better understand chemical gradients. You might say, okay, well, couldn't we just continue to use newspaper data to understand community level gradients? Possibly, certainly. This web scraping is pretty intensive, certainly from a data mining, machine learning, programming. It's pretty expensive to be able to collect this data daily and make sense of the patterns. But what we've really been trying to get at in this talk is collecting samples from the wastewater is relatively cheap, relatively easy, and it could be a much faster way to get at these community level health metrics, community level states of well-being with the chemical data rather than mining newspaper data. So this is a boutique data set meant to really highlight an approach. And so we expected to see the World Athletic Championship. We expected to see those patterns in both newspapers and chemicals. But other community attributes could be similarly captured using the same web scraping technique. Detectable sentiments, things like fear, anxiety, stress, happiness, substance use, mental health. I'd imagine all these sentiments would be captured in newspaper gradients, and we could use the same approach to find a corresponding chemical gradient that relates to these sentiments. Potential health outcomes, there's probably trends in drug use, mental health crises, crime, disease outbreaks, healthcare issues. I'd imagine these can also be found in web data that could be linked to chemical data. David, please, the floor is yours.
Thanks, Jared. Hi, everybody. Thanks for hanging in there. We're almost done. Just a couple more slides here. So just to double down on what Jared was saying, we're really trying to explore connections between the wastewater data and what's going on in the environment and the social context. So I'm willing to bet that most, if not all of you, are very familiar with the the concept and ideas of social determinants of health. So the figure in the right shows a well-known study from the National Academy of Medicine quantifying the percent of health outcomes that are attributed to health behaviors, clinical care, social and economic factors in the physical environment. I mean, we don't really know what these percentages are, but these are rough estimates. And so the idea is that it's really the majority of health outcomes are driven by the environment and the social and economic factors. Okay, so assuming that, we want to empirically test the relationship between the chemicals, the viruses, and the non-target chemical things that Jared talked about, and connect those with social and environmental factors and physical environments. So it's basically, we're trying to explore relationships empirically with those. And as we talk about it, one thing we could do is, rather than collecting annual surveys on education, employment, and income, all the things that as a social scientist that I'm familiar with working on day in and day out, rather than collecting those, what can we learn from the wastewater that might tell us a story about what's going on in those communities? And we expect that when those correlations are high, that maybe we would be making a contribution in how to have a more efficient and more, in some ways, more accurate and valid measure of the social determinants of health, perhaps by just sampling the wastewater. So in addition to the media and web scraping, this is a contribution that we think we can make. Okay, I thought of many, many examples, but the last connection that we're really interested in is something that I think you all care a great deal about, and that is evaluating policies that are in place, public health policies and other policies that we know are taking place all the time. And this is something that I have experience and expertise in trying to understand what is the impact of these certain measures. So 2 quick examples on a statewide level. What is the relationship between something like ballot measure 110 and the rollback, the recriminalization of certain drugs and substances? What is the impact that we see from communities and in the wastewater? There's also numerous local initiatives that are happening throughout your communities, and for example, with Mitchell's group on tobacco prevention in Douglas County. So these are real life public health interventions that we expect to be able to connect in the wastewater and social data.
I just wanted to just reiterate some of these things about how this can actually work for public health and how it can work for us. And one of the big ones, I think is we're no longer just reacting to these public health crises. We actually have this tool that lets us get ahead of them. And so I think we've already seen a lot of this with, COVID and detecting new variants. And there's even articles about measles, salmonella, antimicrobial resistance. There's a lot of uses for this, but I think it's great if we can detect outbreaks before they're even reported. If we can intervene early, before measles, polio, or West Nile virus spreads through a community, we can get on top of these things. And the other thing is this is already happening, right? It's not just about disease detection. Wastewater surveillance is also helping monitor substance use trends, which allows public health, us, to respond in real time with precision. And there's one case in Laredo, Texas, where wastewater data helped guide targeted outreach efforts. And the result of this was a staggering 52% decrease in drug-related deaths. Think about that, a 52% decrease. So instead of waiting for overdoses to rise, these local teams were able to redirect resources to the neighborhoods that needed them most. And so this is what I think of as data in action. And this is wastewater surveillance that's making a real impact. And I think what I love most about this tool, it's not just for government agencies or researchers sitting in offices. This is for us, for local coordinators, for the boots on the ground folks like me and you, because we know our communities. And now finally we have this ability to get data that actually reflects our small communities. It's not a guess, it's not a survey with low participation, it's real actionable data that allows us to see what's happening and make those informed decisions and truly impact lives. And right now, we actually have this rare opportunity to expand this tool using our existing infrastructure with Tyler's team and Oregon State University, and to continue to partner with them. And we can do it cost effectively. Because, let's be honest, preventing an outbreak using wastewater surveillance is far cheaper than dealing with a full-blown public health crisis. And especially in today's political climate, I truly believe that we need to double down on Oregon. I think we should invest in Oregon's future and tools that make us healthier, smarter, and more innovative. And I think we can band together to support wastewater surveillance, and we can use that to reap the benefits for our communities, our counties, and really our state as a whole. So my personal belief is that this is a game-changing tool, and I think we can use it to build a healthier, stronger Oregon.
Thank you all for tuning in to the podcast. We're really excited to have you here and learn about wastewater epidemiology, learn about wastewater surveillance, and the programs we hope to achieve and implement right here in Douglas County, Oregon. If you have questions, again, leave them down in the comments. We monitor those all of the time. We'll be happy to answer your questions you have. And yeah, we'll see you next time. We'll see you on the next episode. Be sure to like and subscribe. Save this to your Spotify playlist if you're listening to this on Spotify. All right, thanks so much. Bye, guys.